Hi, I'm Dr. Janet Alott. I'm a registered nutritionist with a special interest in food, and I'm here today to talk to you about gluten and the effect that it has on people with celiac disease. Celiac disease is actually an autoimmune disease, so it's when the body reacts in an abnormal way to a normal food. So when people with celiac disease eat gluten, the body tries to attack that gluten. And what happens is you get an autoimmune or immune reaction within your gastrointestinal system. And the gluten causes damage to the small intestine, which is the lower part of your gut. And what happens is you have a system within your gut which causes or helps with the absorption of nutrients within the small intestine. And to increase the surface area of the small intestine, you have these things called villi, and they're a little bit like fingers. So we have these, we call them finger-like projections, and these villi are sitting on the surface of your small intestine. And what they do is actually increase the surface area. So it means that you have a much greater area to absorb nutrients into your body. For someone with celiac disease, what happens is the gluten actually causes inflammation in these villi, and that inflammation causes quite substantial damage and can cause the villi to completely flatten. So they have a completely flattened small intestine, which decreases the surface area. There's lots of inflammation, and therefore nutrients can't be absorbed properly. So what happens in celiac disease is when someone has gluten, they have a completely damaged small intestine, completely damaged absorption system, which means they can't absorb nutrients properly, they can't absorb food properly. And that can lead to severe problems like stomach pains, diarrhea, vomiting, all sorts of gastrointestinal issues, and also the malabsorption of nutrients.